Hi, my name is Kathy. I'm an RN injector with Dr. Workman here in Vancouver, Washington. Just wanted to kind of clear up some misconceptions that people have about aesthetic cosmetic injectables and give you a little bit of background on myself and how I got into this and how I hope to partner with you to become your provider. First, a little bit about myself. I've been an RN for 32 years now. For the last 6 years, I've worked in the aesthetics field. I have worked with two of the premier plastic surgeons in the Portland metro area and have recently joined the team with Dr. Workman. Really happy to be here. I'm always amused when I hear people talk about, look at her, she's so Botoxed up, and they may be referring to big lips or just you know, we all watch the Grammys and pick apart all of the stars and think how unnatural they look. But Botox does not add any volume. So when we're looking at cosmetic injectables, we're looking at two things. We're looking at facial animation and we're looking at facial volume. So when a person presents to me with a crease down between their eyebrows from furrowing over the years, that's from muscle activity. That is where Botox comes into play, or Xeomin. Both are neurotoxins that take care of that muscle activity. So what we do is we take small needles and make tiny injections into the area to calm those muscles down so that we're not having all that hyperactivity of the muscle and that hyperanimation that creates the lines on the face. So you can't poof anybody up with Botox. It's absolutely impossible. When you're talking about volume, as we age, we have compartments of fat in our face, and those fat compartments tend to fall. So and then our skin starts to hang as well. So what we like to do with volumizing fillers, and there are several products on the market, is add that scaffolding back, so to speak, to hold those structures in place so the skin drapes better on them. Is it a surgical result? Absolutely not. But there are times where you're just not ready for plastic surgery, or maybe medically it's not feasible for you. This is kind of something that can help you along your way to kind of stave off that tired and saggy and droopy look. And I think most of us, if asked what would be the most disconcerting thing we would see on our face, I think we would all agree sagging is not good. So again, how these products work, we have two neuromodulators that we carry in this office. We carry Xeomin and we carry Botox. Both are excellent products. It's kind of a preference of patient and provider. And with your consultation, we can discuss which would be a better product for you. We also have several volumizing dermal fillers. Again, each one of them behaves a little bit differently. Some are appropriate for the cheeks, some are appropriate for the lips, some are appropriate for the tear trough under the eye, and we just want to kind of figure out what your goals are and which one of these would be the more appropriate filler for you. Probably one of the highest compliments I have received in a really long time was from a client recently who said, you know, you're a lousy salesperson. And I truly am not a salesperson. And there are many places you can go for cosmetic injectables that are salespeople. And I'm an educator, I'm a healthcare provider, I'm a nurse first and foremost. So my hope is to partner with you, come up with a realistic plan, what you want to accomplish, how we can get there, and be your long-term provider. I don't want to meet you just once. We'll make a long-term plan for your beauty needs. Thank you.